There are a number of health centers around the country that have been fixed. On top of this, Vijay, on top of the 450 million, we are spending about 130 million per year on health PPP. These private GPs, the Lotoka and Ba Hospital. So a total of 580 million, which is equivalent to about 4% of our GDP. WHO benchmark is 4.5%. So we are just 0.5% less than the WHO benchmark. So we are doing very well in terms of the budget allocation. But again, the utilization, unfortunately within the Ministry of Health has been low. For example, in the 2023-2024 budget, the underutilization was close to about 68 million. In the 2022-2023 budget, this is before coalition government, underutilization was 56 million. So it's not a new problem under this government there is underutilization.
It's a ministry issue.
It's a civil service. It's
if you're working in a corporate
issues,
sector. If you're working in the corporate sector, it would be a big problem. You haven't met your KPIs. Maybe you'll be without a job.
Yeah, well, you're right. We expect as a government, as ministries, to deliver that. But what I want to say is that we want to also focus big on the public health care, because when you spend, the economics of this is, if we spend a lot more money on public health, on delivery of services, you avoid or you stop people ending up in the hospital, which is more costly. And so we had asked the World Bank to do a report, and that report is going to be launched on Friday. And some of the findings is quite damning, and some of them will be discussed. The Honourable Prime Minister will be launching that report.
Well, we'll go through the issues that you raised. Sure. A very good issue about preventative care.
Yeah.
Now, you have provided the money. The health budget is there. However, we have many issues like medicine shortages, including shortage of critical medicines, endosamplers for women, for gynecology tests, which they have to pay for, reagents to do full blood count tests, antibiotics, blood pressure medicine, etc., all out of stock. What is your plan? Because money is there. The money is there, you say. But the medicine is not there.
Yeah. No, absolutely, Vijay. And I think all those people who have raised this concern, and as a government, we do appreciate, those concerns, and we are sorry that, in some cases, patients go there, they don't find the drug, and shouldn't be like that. And as you said, there is no shortage of funds. The issue has not been a new one. It's not something that just started in the last 2 years. Drug shortage, as you know, when we were in opposition, we always used to get this. And unfortunately, the problem still exists. I have discussed this with the Honourable Minister for Health. He is aware of this, and we are going to look at how we can, change the whole procurement process. The sources of our drugs, we're getting drugs from Australia, but some of those drugs come from India to Australia and then to Fiji. Why can't we import directly from India? So these are some of the options that we are looking at. The next step is for us to have a thorough review of the procurement, of the sources of our supply, and make sure that there is better planning, better management of stock, to be able to see that there is no shortage.
This is being done now?
We are working with the Ministry of Health, and that is something that we are determined to resolve in the shortest possible time.
Dr. Vakamodea again had sent questions in relation to, and because he's the head of the Medical Association, and has sent this, I will ask about the medicine. He said, delays in procurement of medicine and consumables lead to poor health outcomes and even death for Fijians. One of the main culprits here are the government systems and processes regarding procurement, which rightly you've said. Is the government going to make adjustments to this for the Ministry of Health, or is it comfortable?
Dr. Vakamodea is absolutely right, and we need this kind of commentary from professionals like him, and I agree with him. Apart from the process, but I'm going to go a step further. Apart from the processes, we need efficiency within the different government departments, within the Fiji Pharmaceutical Office. So that when we change the process, when we identify the bottlenecks, these processes are then married together, put together, so that the processes also works with the people and the efficiency and the agility and the responsiveness with which the planning ought to be done, so that there is no drug shortage or shortage of basic medicine. So I agree with him 100%. These are issues that can be solved and should be done. And as I said, we have already discussed from the Ministry of Finance with the Minister for Health, and both he and I agree that we need to review these processes, review the sources of supply, and bring in better planning and management and agility and responsiveness within the various departments of the Ministry of Health, so that these consumables are not facing shortage in hospitals and health centers.
Hopefully this is happening, as you said, is in action now. The other question was in relation to a budget address last year. You spent a significant proportion of health discussion focused on issues with Aspen. Today, their medical service seems to be constantly improving to a point where they're better than CWM Hospital. Is the government going to address?
Government is paying every single cent